Welcome to CareForce's presentation on what is home care in Washington State. You are probably here because you have had home health ordered and you're wondering what that involves, or you are wondering if you qualify for home health paid for Medicare and private insurance, or if you have to purchase private duty care.
When you come home from the hospital or rehab, or you've been ill at home and your doctor says, I'm going to order home health for you, sometimes people don't understand what that means. And what it does mean is that if they do order home health, you will get a nurse or physical therapist that will come to your home, and they should arrive within 48 hours of that order.
This type of care is called intermittent skilled home health care. Intermittent skilled home health is the type of care that is paid for by your Medicare or health insurance. In order to qualify for Medicare to pay for your home health care, you have to have either nursing or physical therapy goals. An example might be that you have a wound that needs a registered nurse to come and take care of it, or that you're a newly diagnosed diabetic and you need some help in managing or learning how to use your insulin in managing your blood sugars. Or you might be coming home after a hip surgery and you need some assistance in learning how to walk around your house or up and down stairs in your house. In addition, you have to ask yourself, or your doctor has to ask you, will you be homebound? What that means is, the question is it extremely difficult for you to get out of the house for a doctor's appointment, to go and get supplies that are needed, or to go and get groceries? If you are homebound and have nursing or physical therapy goals that have not yet been met, your doctor can order intermittent skilled home health care that is paid for by Medicare or by your health insurance. These services must be ordered by your physician or primary care provider and must meet the Medicare or health insurance criteria. Usually, most important is that you still have nursing or physical therapy goals and that you are homebound. So what are these skilled home health care services that you're going to receive? You know that they may be nursing or physical therapy in nature, but what does that mean? The care paid for by Medicare is by the visit. A nurse and or physical therapist, in addition to an occupational therapist or a social worker or a home health aide or bath aide if you need them, will come to your home 2 to 3 times a week. Sometimes it's less, sometimes it's more. They will assess your progress, they'll help you with treatments, and the home health aide will assist you with a bath or shower. In addition to this, your nurse and physical therapist and occupational therapist are the eyes and ears of your physician in your home, so they will communicate with your physician. Each visit is usually 30 to 60 minutes in length, although it may be more.
These visits continue until you have met your nursing or physical therapy goals, and then you are discharged from home health, or you will be discharged from home health if you are no longer homebound.
Typically, a qualified person receives skilled home health care paid for by Medicare or health insurance for between 4 to 12 sessions. Sometimes it goes on longer. Again, it is required that you continue to have goals that can be met and that you are homebound. Once you are discharged, if you need any help in the home, you will need to hire privately and pay for it out of pocket or with long-term care insurance. And any treatments or assessments you need that you do not want to hire privately to have somebody come to your home, you will need to go to the doctor or clinic for those treatments or assessments. So what if, when you are getting Medicare home health care, or after your Medicare home health care is done, you need more help in the home? Sometimes family is not available, or family can't provide the care that you need, or you don't have any family. So where do you turn if you need more care than what Medicare provides? If you want to hire a caregiver, order the care from a private duty home health or non-medical home care company. This is sometimes called custodial care, personal care, or homemaker care or companion care. It depends on your needs.
Care can be hired through CareForce or another private duty agency or an independent provider. If you have very low income, DSHS or Medicaid will assist you in finding an agency. And that number for DSHS is 1-800-562-3022. What are non-medical home care services, or what we call custodial services or private duty care or companion care? A caregiver can come to your home to assist you with any of the following. They can help you with bathing or showering. They can help you getting dressed or undressed. They can help you in the privacy of your home with your toileting needs or incontinence care that you might need. Some adults need help with medications, either medication reminder or people helping them get their medications out of their Mediset or out of their pill bottles. A companion or caregiver can do meal prep. They can clean up after a meal, and they can help you with eating or feeding if you need that. Light housekeeping or laundry are often things that adults need help with in the home. We can strip your beds. We can make sure that your towels are tidy and smell nice and fresh. We can help you with walking in your home, around your community. We can help you using a wheelchair. We can help you if you have a walker and you need assistance getting up and down stairs, getting in and out of your car. A caregiver might be able to provide you transportation to run errands or go get groceries. And in addition, a caregiver might provide safety supervision. For example, if you need somebody to be your companion, that you don't really necessarily need help in some of these areas, but you just need somebody to be with you, either for part of the day or around the clock. CareForce provides this care as a private duty home health or non-medical home care agency in your home or apartment.
There are a number of different ways that private duty home care provides care. One is to order hourly caregiver care. Typically, this is 4 hours or more in a shift at a time. At CareForce, it's up to 12 hours at one time, days or nights, and it's usually awake on duty. Shorter caregiver visits are 90 to 120 minutes. Someone may come into your home in the morning and help you get dressed and help you get on the toilet and off the toilet, and with your morning care, make you breakfast, remind you about your medications, and then leave you alone for the day. Some people need hourly caregiver care around the clock, which means that you have an awake shift, 2 awake shifts, 12 hours back to back, so that you have a caregiver with you at all times. This is typically when somebody has needs around the clock. At CareForce, we have our unique and trademarked care pack services for transitional care. We offer an activity care pack to help you get moving after you've been hospitalized and you're gaining strength. Have somebody come in and follow your physical therapy with you. We have our transitional care intervention, which can teach you how to keep yourself out of the hospital after you've been discharged. CareForce provides live-in care with a sleep shift at night, meaning that a caregiver comes in and stays for 3 or 4 days at a row, and they will sleep in their own bedroom in your home. And finally, CareForce can offer you private duty registered nurse or LPN care. So for example, if you are needing some IV infusion and you don't qualify for Medicare or Medicare doesn't pay for IV infusion, we can provide a registered nurse to come into your home to provide that IV infusion. How do you find a non-medical home care service? Well, CareForce is a private duty home health and non-medical home care agency. Every county has a senior information and assistance department that can send you a guide. In King County, it's 1-888-435-3377. In Snohomish County, it's 425-355-1112. If you live in a different county, just put your county in a Google search and put in Senior Information and Assistance, and your county's department should come up. You can ask your doctor or your discharge planner for a home care list. Many organizations have developed a list of home care agencies that they trust. And if you're low income, you can call your local DSHS or Department of Social and Health Services office and find out if you qualify for Medicaid services. And that's 1-800-562-3022. How do you pay for custodial care or non-medical home care services? Most people pay out of pocket from their private savings or their retirement income. Some people have long-term care insurance that will pay for non-medical home care. And CareForce can help you discover what you need to do to qualify for your long-term care insurance. Some people qualify for some home care from the Veterans Administration. You can call the VA. Sometimes a health insurance policy will pay for custodial care or personal care, but this is very unusual. Usually you have a premium health insurance if you are getting any private duty care through your health insurance. If you have any questions about home health or home care, please don't hesitate to call CareForce. We're here to answer the phone 24/7. Our nurses and social workers are available days and evenings. When you call 1-877-426-8800, you will talk with a CareForce person, and they will be able to connect you to an MSW or a nurse. And please go to our website at careforce.com. Thank you so much for listening to this presentation.